everybody, and welcome to another episode of Connect with the Nurse. We are having conversation on the patio today, so I am super excited for some girls chit chat time and all that good stuff. Most of the time, when you guys see me, I'm always by myself, so I have me a guest on today, and we might act up a little bit. You don't know, we'll see. So, guys, we're talking about expanding and maintaining self care in the workplace, and that's whatever you do. Again, because this is Connect with the Nurse, you're just connecting with the nurse, and that would be me. And so, with that, we cover a lot of different broad topics and things like that. And so, today, again, we're going to talk a lot about self care, just maintaining that. And so, I want to kind of address self awareness. And that with us being out in corporate America or hospital life or whatever it is that you do day to day, sometimes it's difficult to be aware of our bodies and maintaining that awareness in ourselves and where we are, whether it's physical, mental, spiritual, it doesn't matter really. But being grounded in those things that are really important for us is really what makes the big difference. So, I want to talk about that feeling of self awareness, taking care of yourself, your mind, your health. How do you feel about that in the workplace? And so, with that, it's like, doing a lot. We move around a lot. Some of us are 9 to 5, 8 to 5, midnight shifts. It just really doesn't matter what that particular role and time frame is that you spend at work. But I think the difference is how you maintain. So, with that, are you aware of those things that can go on, when we're moving so much without stopping a second to take care of ourselves and going so fast that the next thing you know, we've fallen out, blood pressures are up, cholesterol levels are up, you're stressed out, heart attacks and things like that that can happen in life. And so we're going to go so many different angles with this topic. This is part one. My next podcast, you will see part two. And so some very good information to point out and pull out today. And so with that, Carla, I'll let you kind of introduce yourself a little bit. So a little bit about her. Carla and I are longtime friends, but let her give us a little bit about her background and things like that.
Okay, well, my name is Carla Cameron. I have been a nurse for about 15 years.
Awesome.
I started out as an LVN and transitioned over to RN.
Yes.
And I have been in a couple of different spots, far as rehab, post-surgery, long-term care, hospice, home health, couple of different places, and I've always returned back to the rehab division of it. My feeling on far as medically being a healthcare provider, we do have to focus so much on ourselves as the healthcare provider. We're so used to taking care of everyone else and not our own selves. So one thing about it is I have a family. I stay busy. I'm a vampire. I work mostly nights now, and I do have to focus on trying to shut myself down a little bit, and so this topic is hitting home for me because I need to focus on my health and my self-awareness and my self-preservation. So this is a topic that I really can focus in on.
Awesome, Carla. And so with that, guys, when we talk about self-awareness, I want to really point out is being aware that you have these concerns, that this is the vitality of what you have going on. This is the impact. That's making sure that you are, number one, aware, because basically before we can do anything, we got to be aware of what's happening. And so, a lot happens in our life to where we go through different pathways and different channels and things like that. And as a result, you've got to be aware of what that root cause is. Finding out what that root cause is makes us better able to deal with those instances and those circumstances. And so we want to also hone in on basically the self-perseverance. How do I preserve where I'm at? We want to hone in on self-care. What do I do to make sure that I am able to validate the awareness that I have, right? So if I'm feeling a certain kind of way, how can I care for myself and make sure that what are some things that I can do to decrease stress levels and help my anxiety levels? Because, a lot of personals kind of get into the way of that work setting and things of that nature. So we just want to make sure that we hone in on that. And so, Carla, I know you're big on you do a lot of herbals. You like your teas. You do well woman and things like that. So expound on a little bit about that. What are your thoughts of self-care today?
Self-care is very important. Self-care is something not only physically but mentally you have to self-care. We as healthcare providers and just corporate America period, we have to focus on our self-care, and mental is a big part of it. Sometimes we can get mental burnout. We don't see that until it's to the end, but we need to start paying attention to that, because a lot of times we run, the hustle and bustle of the day, and we're not focusing on ourselves and taking that time out. And I'm a witness of that, where I don't take time out for myself. So mentally, I have to shut down everything. If that be job, family, just shut down for a little bit, take time for yourself, and get back to a certain point where you can get back out there and do what you're meant to be here to do. So my biggest part is mentally. Physically, I have to take care of myself. I have to eat right. I juice. I'm trying to walk. Trying to eat right, and buy the right foods. We cannot be healthcare providers and not take care of ourselves.
Absolutely.
And we're educating patients how to eat. Yeah. And we're educating patients how to take care of themselves. So we have to focus more on taking care of ourselves mentally and physically.
Sure, absolutely.
So that's my biggest point. I do have a point where I do need to slow down. I can't be there for everybody.
Yeah, for sure.
And when it's time to stop and take care of yourself, you have to do it. So
that's really good, because I also think that knowing your limitations and boundaries, I talk about that a lot in life altogether, right? Knowing the limitations and boundaries, knowing when to say no, because that's a part of caring for me. Because you get run down a lot and pretty easy, when you're trying to do everything, especially if there's little children involved. Or you may even be caretakers of parents and things like that, which would really cause you to be more busier than norm, versus somebody who really don't have a lot to do, but they're that person that really takes care of themselves. And so it's about taking care of us, getting massages. I'm big on that, because we go from day to day. You're tired, you're achy. Mentally, it's really draining. And so what can happen is, you might be angry all the time, upset or whatever, and then realize, hey, what's going on? You got to take a time out for you and learn what are those fun things that you do, even if it's like catching a movie. Winding down. It's okay to go by yourself. It's okay to do things alone without always having to have somebody there all the time. And so I think that makes a big difference when we talk about self-care and how to maintain.
Yes.
And the awareness of where we are and identifying with those things that we have going on. And so that makes a big difference how well we deal with those things. All of us know we love to vacation, but you might not always be able to vacation at that time. So it's like asking that question, well, what can I do right now that I can get help with where I am? Therapy is always good for self-care. Sometimes we keep things bottled up inside and really don't want to deal with what's going on around us, but realizing that it's okay to allow somebody else to talk and walk us through that thing. Good meditation and self-care, kind of just taking a time out and relax a little bit. If you like wine, having a glass of wine. And Carla, you mentioned something about herbals, and teas, because I tell you what, she really turned me on to a lot of that herbals and teas, and I love it. I tell you what, like drinking that tea, green tea, I love infusing my drinks and things like that. It's so good for relaxing and relaxation. Melatonin.
Yes.
I love melatonin, and it's so awesome to be able to take that. Lotions that contain those mild sedatives in it is really nice also, just to help you relax and just to get that mind going and get your mind flowing. Um, and guys, a lot of you, if you're experiencing things like muscle aches and cramps, I know you were the one that turned me on to the magnesium.
Magnesium, yes.
And as long as I've been in the industry, I was like, what? I didn't even think about that. And so that was amazing. Like, literally, if you have not tried that, I do take magnesium. I do like one at night.
Yes.
And it just puts you to sleep just like a baby. You're out.
They do.
And you're like.
And also they have like, I use some of the magnesium spray on my feet.
Yes.
I even put some on my 11-year-old feet, and she's like, oh my goodness, Mom, I slept so good. I want to go back to sleep. So you have to find different ways to help you relax. And me being, like I said, working nights sometime, I have to get that extra step where magnesium relaxes me. And I'll get in there and spray my feet down, put my socks on, and you would never believe. I even have my mom doing it. And
I love it.
My brothers with their big feet, they're doing it. And so everyone's buying this magnesium spray.
Yes.
And it really do work. It really relaxes you. So that's my go-to right now is magnesium. Also, I do a lot of teas. They have the hibiscus tea. I do peppermint tea. They have a sleepy time tea. Just stuff to kind of relax you a little bit before going to bed. So
I love it. And guys, I'll tell you what, I'm super excited because I am actually growing some herbals. And I'm doing some like spearmint. I'm doing peppermint. I'm so excited about it. My basil. I'll show you guys that on another one of my episodes. But I'm just happy about my herbals, and so I'm going to be using those also in my drinks. They're getting ready. They're in the making right now. So as soon as it's time, I'll start showing you guys what the garden looks like and things like that. But yeah, doing all of that, I think it's a big help from day to day, because we do so much buying, things from the store, which contains so much,
it do,
stuff in it. And so this summer, I really wanted to really hone in on herbals and what it's like to kind of grow some things and see what my results are.
And not only that, it relaxes you. It relaxes you to be out here, to be in your garden after a long day of work and dealing with so many meetings and so many interviews and so many conferences. You come out here and you get in your garden and you dig around and you get that extra little time to yourself. And you have to find that time to yourself. Me, I like cooking. So when everyone's at the house during the day, I get in the kitchen and I'll cook. And that relaxes me. So you have to find that self-care time where you can do something, a hobby, something that you like that help relax you. So that's mine is cooking. And I know Miss Demetria got into gardening.
Yes,
so you just have to find that itch where it can help you out a little bit to relieve your stress.
Also, you know what? So when we talk about the self-awareness and the self-care, we also have to think about perseverance, preserving all of that we do and maintaining all of that we do without going overboard. You want some water? Because I don't want you to be too hot.
No, I'm good.
You good?
I'll get a little bit.
And so the thing about that, guys, is the self-perseverance in all of this that you do each day. It's about asking the question, how do I maintain that what I'm working so hard to do? And I think setting the course of action in your life and setting the course of action around your activity in your life, whether it's family, children, work, parents, church, it doesn't matter, but just setting those zones and the tones, for what you need to do, being consistent with it, taking care of yourself, because sometimes I think a lot of us who make resolutions, I do my best to stay away from making New Year's resolutions, because that's something that you are all excited about at the first year, and then the next thing you know, it's like
gone.
March gets here and we're pretty much done with that. And so I think it's just setting goals. My life has really functioned around goal setting. I set goals for what point I'm at and how well can I keep and maintain that goal, that stage, that age. how many years I feel like it may take to get to the next level. And so with that, I think being able to maintain in the perseverance, getting you to where you feel like you need to be, and then just making sure that it's been consistent and that you keep it going, and then you just maintain. You may have cocktail Tuesdays, and every Tuesday we do cocktails, or you may have massage Mondays. I've taken a time out, and each Monday this is what I'm going to do for me. I'm going to be consistent with it, if not every month, every other month, but enough I think to where that you have this maintained for yourself, and then making sure that pretty much everybody else respects what you're doing, what you have to do.
Well, that's something you have to do. You have to let people know what's your time and what's their time, because a lot of times we set our time aside. We push it aside and do everything for everyone else, and I'm a witness to that, because working nights, some mornings I'll have to get up. Family might realize that I'm off that day, and oh, what are you doing? Well, I'm asleep. Oh, I didn't mean to wake you up, and they go into asking you what they can do. You have to set that time. It's hard for me to turn my phone off. It's hard for me to turn my phone even on vibrate, and so I'm looking for someone to call to wake me up. But I'm not setting myself up to get the rest I need. So as I've got older, I've realized, okay, I need this rest. I need this time to myself. And so it's about you making that choice to say, okay, this is for me. I know I have to work later on. I need to sleep.
Absolutely.
So just being aware and setting your limits up to where, okay, I need at least 8 hours of sleep. Or I need to rest in the house by myself for this amount of time. So
you know what, and what I'm getting out of that too is just simply respecting your space. Making sure that someone can respect your space when what I do. And the fact that we have all of this going on, and so with that, everybody has to respect where everybody is, and then making sure that you maintain that self-grace while maintaining everything else that you have to do from day to day. So I think that plays a major role in everything that we have to do. And so we would really love to hear from you as well, what your thoughts are. How well do you maintain self-care? And then preserving that self-care that you have maintained. What are some things that have happened to you that you could think about and relate back to, and you're like, oh, you know what? I had to try that too. Because I think it's a lot about what I went through, in my career and in life period, that really makes you have to realize, what, it's time to stop and start to think about what I need to do, especially as we start to age and want to age with care and grace. You really want to start thinking about those things. I know for me, like when I was younger, I could stay up. Oh my gosh, I would be up so late.
Oh yeah.
Now it's like as soon as the sun goes down, I'm like, it is time to go to bed. That's a no.
Yeah.
And you got to make sure you get all those hours of sleep and rest in. And so with that, it's just like I said, maintaining and making sure that you have done all you can do to take care of self.
That's right.
If we don't take care of self, we can't do anything else. Can't take care of anybody else. It's not going to happen. And so those are some things that we just want to make sure that we keep aligned up with our day-to-day and everything that we do. So what are some points that you would like to leave with everybody today as they listen in?
Well, what I would like to leave, something I want to practice and be more into, is number one, make sure your mental is there. Make sure you're mentally restored before you start another situation, before you go into another ordeal. Make sure your mental is there. Secondly, you have to have your physical there. Physically, you have to be able to take care of yourself in order to take care of anyone else. You have to. Thirdly, for me is spiritually, which should be number 1, 2, and 3. But spiritually, you have to have that spirit. You have to have something that you believe in, a higher level. Mine is God, Jesus Christ.
Absolutely.
But everyone has a different higher level. So you have to have something that you believe in spiritually that can keep you daily, keep you throughout the week, pull you through when you have tough times. And that's big for me. And pulling that in on Sundays, I have to have enough to go through the week with. Because we deal with a lot in healthcare, and that's just personally for me, seeing the people that we see and taking care of the people we take care of, taking care of family, going home, making sure your family is okay, and then making sure you're okay so you can continue taking care of other people. So we have to make sure first that we have to put ourselves first, and that's one pointer I need to focus on a little bit more for myself. Sure. So that's what I need to focus on. So
I like that. It's pulling out that start of the week, whatever your start of the week is, whatever day your start of the week is, and getting your mind refreshed and ready to take on everything else that you have to do. I think that's a big part of, what we do and how we maintain. So I love those points that she pulled out. Definitely finding that inner being in your spirit, what's going to work for you, whatever that is. Like I said, it could even be meditation for some of us. It helps and it works. It definitely does. So I think that's a big part of, how we control things, maintain, make sure that we're on point, and things like that. So yeah, definitely guys, definitely hit me up, like or subscribe. Let us know what your thoughts are. We definitely hope that you have enjoyed today's podcast on self-care. If there's anything you would like us to cover within this episode, there will be part 2. Please let us know that. Send us some questions or anything that you would like to do. Carla, I want to thank you for taking the time out to join me today.
I enjoyed this talk. It really helps me out to focus more on what I need to do.
Absolutely.
And sometimes we just need to sit down and have a chit chat to pull back what we need for ourselves.
Absolutely. I love it. All right. So guys, thank you so much for joining us today, and see you back soon. Have a great day.